ready?
Mm-hmm.
Okay, there you go.
Oh, anytime? Oh, okay. Hi. My name is Kathryn Richer, and I'm the manager for the Northwest Oregon Health Preparedness Organization. And I am here to present a project proposal. A catastrophic earthquake such as the famed Cascadia subduction zone earthquake or a Portland Hills fault quake where I happen to live are known high impact events that will definitely devastate the UASI region's existing healthcare delivery system infrastructure. So the proposed project actually will build on a regional catastrophic disaster system of medical care project that we're going to develop a response plan for disaster-based care during the first 2 weeks after a catastrophic earthquake. And that plan will focus on patient triage, including casualty collection points, transportation, medical care points, identifying our gaps in our system of care, and also mapping tools. And this is already funded with UASI 19 funds for the time period starting July 1st of 2020 and will be 2 years in its actual execution through June of 2022. As you know, and we've had discussions at many tables, there are a lot of plans and approaches in place. And what we would like to do is pull them all together so that we really have an understanding from the point of impact that needs medical care to the hospital and then hopefully full circle back home. So the first phase of that is actually the response plan. What we're requesting is a second phase of that, which is to develop, for those in the room, I have a handy dandy brief list of this that breaks down the actual application. This is the recovery plan side of it, which looks at how do we transition the catastrophic disaster system of care to recovery. So from active response to healthcare delivery system recovery needs to support providers and patients at 2 weeks, 2 months, up to a year after an earthquake. So that will involve things like looking at what will our disaster impacts be, what would be the priorities for restoration of services and resource prioritization, what would be the strategy for supporting continuity of care for our medically fragile individuals in their primary care medical homes and specialty care environments, which is actually part of the first phase, but that's already being built into it. We're also looking at public information messaging, as well as how we can align the recovery planning with the RDPO regional recovery framework that had a lot of good time investment and is a great framework. We would also use our existing MAC system trainings and exercises to discuss what might be our potential scenarios, where decision making would be needed for allocation and prioritization of healthcare recovery resources. And last, develop a prioritized list of healthcare systems lifelines and critical services and processes or resources that would be needed to support their return to routine services. So this would be conducted by our health preparedness organization staff, as well as the response plan development. That is the plan for that. It would be also done through our staffing, and the request is for $80,000 for 1 year that would begin July 1, 2022 and be finished by June of 2023. Do I have any questions or comments? And I know that many of you, half of you have heard this a couple times, so anyone on the camera have it? Just